What is adamantinoma, the rare bone tumor? Imagine a slow-growing growth inside your bones that can sometimes be tricky to spot early. That's what an adamantinoma is, a very rare type of malignant bone tumor that usually develops in the long bones, most often in the shin bone or tibia. It gets its name because, under the microscope, it looks similar to a tumor first described in the jaw, called an odontogenic tumor. But tumors in the bones of the leg are quite different and can spread to other parts of the body. Adamantinoma mostly affects young men, but it can occur in anyone from teenagers to middle-aged adults. Most cases are diagnosed between the ages of 20 and 50. The tumor is made up of two types of tissue: epithelial cells, which line surfaces and cavities, and osteofibrous tissue, which is bone mixed with fibrous tissue. This unique biphasic pattern helps doctors identify it under the microscope. The exact cause of adamantinoma remains a mystery. There's no clear link to exposure to chemicals, radiation, or specific activities. Sometimes, people report a history of injury or trauma to the affected bone before diagnosis, but this isn't always the case. Because it grows slowly, symptoms can be mild at first, making early detection difficult. Common signs include swelling over the affected area, persistent dull pain, tenderness, and sometimes redness. Over time, the bone may become deformed, like bowing of the tibia. In some cases, the bone weakens enough to cause a fracture without much trauma. Patients might also notice difficulty moving the limb or limping. Often, adamantinoma is found incidentally on X-ray images taken for other reasons or after symptoms become more noticeable. On X-rays, it appears as a lesion or abnormal area within the bone. To confirm the diagnosis, doctors perform a biopsy examining tissue under a microscope to look for the characteristic biphasic pattern. Recent studies have identified potential biomarkers, such as increased DLKI1 gene expression, which might help distinguish adamantinoma from other bone tumors. Treatment mainly involves surgery. Because the tumor does not respond well to chemotherapy or radiation, removing the affected bone segment is the primary approach. In some cases, especially if the tumor involves major nerves or blood vessels, amputation might be necessary to ensure complete removal. Since adamantinoma can recur even many years after surgery, long-term follow-up with regular imaging is essential. The outlook for patients who undergo proper surgical treatment is generally good, with high survival rates after 5 or 10 years. Still, there's a risk of the tumor coming back or spreading to other parts of the body, which makes ongoing monitoring important. While rare, metastasis can occur, especially to the lungs or lymph nodes. In summary, adamantinoma is a rare but serious bone tumor that grows slowly and often affects the tibia. Its distinctive biphasic tissue pattern helps in diagnosis, and surgery remains the main treatment. Because of its potential to recur or spread, careful long-term follow-up is crucial. If you or someone you know has symptoms like persistent bone pain or swelling, it's important to see a healthcare professional for proper evaluation and personalized care. Always consult medical experts for diagnosis and treatment options tailored to individual cases.